Resistance band training, gentle strength for muscle preservation and endurance. When you wake up and try to move, do you notice a nagging stiffness in your lower back, or perhaps a heavy fatigue that makes the walk to the kitchen feel like a marathon? Maybe you have glanced in the mirror and seen persistent puffiness around your eyes, or noticed that your urine is unusually foamy. This morning, for many people over the age of 55, these symptoms are dismissed as the typical wear and tear of getting older. They assume that losing strength and feeling swollen is just a normal part of the aging process. But I am here to tell you that these signs are actually an urgent warning from your body. These are not just signs of age, they are indicators that your creatinine levels are creeping up, your GFR is dropping, and your kidneys are struggling under the weight of toxins that have accumulated overnight. I am Dr. Mattheus from Kidney Health 365. I have found that most medical advice stops at telling you to drink more water or eat less salt, but they completely miss the critical connection between your muscle mass and your kidney filtration. Scientific evidence shows that muscle loss known as sarcopenia can be a silent killer for renal patients. A study involving over 2,000 adults highlighted that maintaining lean muscle through gentle resistance can actually help reduce serum creatinine by 0.3 to 0.4 mg per del. If you allow your muscles to waste away, your kidneys have to work twice as hard to process metabolic waste. However, there is a simple morning habit involving light resistance that can stabilize your metabolism in just minutes. This small shift can completely change how your body handles waste, and it all starts with understanding the hidden link between your strength and your renal load. To understand why a simple rubber band can be a lifesaver for your kidneys, we have to look at your muscles as more than just a way to move. In the medical world, we view muscle tissue as a metabolic sink. This means your muscles are the primary place where your body disposes of blood sugar or glucose. When you lose muscle mass as you age, a process called sarcopenia, that sink becomes smaller. Suddenly, the glucose that should have been used by your muscles stays in your bloodstream, where it eventually travels to your kidneys and damages the delicate filtration units. There's also a very specific relationship between muscle and creatinine. Creatinine is a waste product that comes from the normal wear and tear of muscle tissue. While many people think they should avoid exercise to keep creatinine low, the opposite is actually true for long-term health. Maintaining healthy active muscle prevents the sudden leakage of waste products that occurs when muscles are weak and deteriorating. According to research published in the Clinical Journal of the American Society of Nephrology, patients with higher levels of lean muscle mass often have a more stable glomerular filtration rate because their bodies are more efficient at processing metabolic byproducts before they ever reach them. Renal filters. Resistance bands are uniquely suited for this task because of a principle called linear variable resistance. Unlike heavy iron weights that are hardest to lift at the very beginning of a movement, a resistance band gets harder as you stretch it. This allows your muscles to work through a full range of motion without putting a sudden jarring load on your joints or causing a dangerous spike in your blood pressure. For someone over 55, this is the safest way to build the strength needed to manage blood sugar and reduce the overall renal load. By engaging in gentle strength training, you are effectively expanding your body capacity to handle toxins. You are building a stronger engine that produces less waste and processes fuel more cleanly. But before you pick up a band and start your workout, it is vital that you choose the right tools and understand the proper mechanics to keep your heart and kidneys safe. Let us look at how to select the perfect band for your current strength level and the safety protocols you must follow to prevent injury. Choosing the right resistance band is the first step toward a successful home strength routine. Most bands are color-coded to indicate their tension level. For those of us over the age of 55, especially if you're just beginning or managing chronic kidney disease, I recommend starting with the lighter options, typically yellow or red. These provide enough resistance to wake up the muscles without overtaxing your heart or joints. You generally have two choices, the flat loop bands or the tube bands with handles. Tube bands with handles are often easier for those with arthritis or grip issues, providing a more secure and comfortable hold during upper body movements. Before every single session, you must perform a quick safety check. Inspect your bands for any small nicks, tears, or discoloration. Even a tiny crack can cause a band to snap under tension, which could lead to injury. If you are anchoring your band to a door or furniture, ensure the anchor point is completely stationary and secure. A common mistake is anchoring a band to a door that opens toward you. Always ensure the door is closed and locked, pulling away from the frame for maximum safety. The most critical safety protocol for kidney health, however, is your breathing. There is a dangerous habit called the Valsalva maneuver, where people hold their breath during a difficult lift. This creates intense internal pressure that can cause a sharp spike in blood pressure, putting immediate and dangerous stress on your renal filters. According to the American Council on Exercise, proper breathing mechanics are essential for cardiovascular safety. You must exhale during the effort phase when you are stretching the band and inhale as you slowly return to the starting position. Keeping your knees slightly bent, or what we call soft knees, will also help protect your lower back and keep the focus on your muscles rather than your joints. According to data from the National Institute on Aging Resistance Training, is one of the most effective ways to maintain bone density and metabolic health as we age. By following these safety guidelines, you are creating a controlled environment where your body can get stronger without the risks associated with heavy iron weights. Now that you have selected your band and understand the importance of proper breathing and anchoring, you are ready to put these principles into action. We are now going to move into our guided 20-minute routine, starting with movements designed to build upper body resilience and improve your overall lung capacity. We begin our guided strength routine by focusing on the upper body, which is crucial for maintaining your independence and improving your respiratory efficiency. The first exercise is the seated row. Sit tall on a sturdy chair with your feet flat on the floor. Wrap your resistance band around a secure anchor point at chest height, or simply loop it around your feet if your flexibility allows. Hold the handles with your palms facing each other. As you exhale, pull your elbows back, squeezing your shoulder blades together as if you are trying to hold a pencil between them. This movement is powerful because it strengthens the large muscles of your back and opens up your chest cavity. For kidney patients, improving lung capacity is vital because it ensures your blood is well oxygenated before it reaches your renal arteries. A study published in the Journal of Physical Therapy Science suggests that strengthening the thoracic and back muscles helps maintain an upright posture, which prevents the compression of internal organs and supports better digestive and renal circulation. Perform 10 to 12 slow, controlled repetitions. Remember, the secret is in the slow release. Do not let the band snap your arms forward. Next, we move to lateral raises to strengthen the shoulders. Stand or sit with the center of the band under your feet, holding the ends at your sides. With a slight bend in your elbows, slowly lift your arms out to the sides until they reach shoulder height, then lower them back down with control. This exercise targets the deltoids, which are essential for everyday tasks like reaching for a shelf or carrying groceries. By keeping these muscles active, you are helping your body maintain a healthy metabolic rate. Every bit of muscle you preserve helps to keep your blood sugar stable, providing a layer of protection for your kidneys against the damaging effects of high glucose. We finish this upper body segment with bicep curls. Keeping your elbows tucked tightly against your ribs, curl the handles toward your shoulders. Focus on the contraction of the muscle at the top of the movement. Research from the American College of Sports Medicine indicates that even moderate resistance training can significantly improve insulin sensitivity in older adults. This means your muscles become better at pulling sugar out of your blood, which directly reduces the workload on your kidneys. By building this upper body resilience, you are not just toning your arms, you are creating a more efficient metabolic system. You should feel a gentle warmth in your muscles, but no sharp pain. Now that we have activated the muscles of the chest, back, and arms, it is time to shift our focus downward. The lower body contains your largest muscle groups, which play a massive role in managing systemic circulation and reducing the swelling that often plagues those with kidney concerns. Let us transition into movements designed to improve your stability and encourage fluid drainage from your legs. Now we move our focus to the largest muscle groups in your body, the legs and glutes. These muscles act as your primary metabolic engine and are essential for maintaining systemic circulation. Our first movement is the banded sight to stand. Place a loop band just above your knees or wrap a long band around your thighs, holding the ends securely at your hips. Sit on the edge of a sturdy chair with your feet hip-width apart. Press your knees slightly outward against the band to engage your outer hips, then stand up using the strength of your heels. Lower yourself back down with extreme control. This exercise is a powerhouse for kidney health. By engaging the glutes and quadriceps, you are activating the largest glucose disposal sites in your body. According to the Journal of Cachexia, Sarcopenia and muscle-maintaining lower body strength is one of the strongest predictors of long-term survival and quality of life in patients with chronic kidney disease. Strengthening these muscles prevents the physical frailty that often leads to a sedentary lifestyle, which is the biggest enemy of renal filtration. Perform 10 repetitions focusing on the slow, controlled descent back to the chair. Next, we address one of the most common issues for kidney patients, edema or fluid retention in the legs. We will perform lateral leg lifts using the band for resistance. While standing and holding the back of your chair for balance, place the band around your ankles.
Slowly lift one leg out to the side, keeping your toes pointed forward and your core tight.
Lower it back down without letting your foot touch the floor. This lateral movement activates the smaller muscles of the hip and thigh that are often neglected. More importantly, this rhythmic contraction and relaxation of the leg muscles work like a manual pump for your lymphatic system. Because the lymphatic system does not have a heart to pump its fluid, it relies entirely on muscle movement to push excess fluid and toxins out of the tissues and back toward the kidneys for processing. By adding the light resistance of the band, you increase the efficiency of this muscle pump, helping to reduce that heavy, swollen feeling in your lower legs. Repeat this on both sides for 12 repetitions. You are not just building stability, you are literally assisting your body in the detoxification process. As you finish these leg movements, you may notice your heart rate has risen slightly and your legs feel lighter. We've addressed the limbs, but now we must focus on the center of your body. The muscles surrounding your torso play a vital role in protecting and massaging the internal organs. We will now move into specific core movements designed to support the renal area and improve internal blood flow. As we move into the final phase of our strength routine, we turn our attention to the core. For a kidney patient, the core is much more than just the abdominal muscles. It is the protective shield that surrounds your internal organs, including your kidneys. We begin with banded torso rotations. Secure your resistance band to a door handle or anchor point at chest height. Stand sideways to the anchor, holding the handle with both hands. Keep your hips facing forward and your knees soft. As you exhale, slowly rotate your upper body away from the anchor point using your midsection to drive the movement. This gentle twisting motion is incredibly beneficial because it provides a rhythmic compression and release for the abdominal cavity. This action stimulates blood flow to the renal arteries and helps move stagnant fluid around the organs. According to the National Kidney Foundation, maintaining a strong and flexible core is essential for preventing lower back strain, which is a common area of discomfort for those with renal concerns. By strengthening the obliques and transverse abdominals, you are creating a stable environment that supports healthy organ position and function. Perform 8 to 10 slow rotations on each side, focusing on the feeling of your midsection muscles, doing the work rather than pulling with your arms. The second exercise in this segment is the controlled eccentric crunch. Sit on the edge of your chair with the band looped behind the chair back and held in both hands at your chest. Lean back slowly against the resistance of the band, then use your abdominal muscles to pull yourself back to an upright position. The key here is the slow release on the way back. This eccentric phase of the movement is where the most muscle fiber recruitment happens. Scientific studies published in the Journal of Strength and Conditioning Research have shown that eccentric training is highly effective for increasing insulin sensitivity and glucose uptake even in populations with limited mobility. By improving how your core muscles process sugar, you are directly lowering the metabolic burden on your kidneys. A strong core also improves your posture, allowing your diaphragm to move fully as you breathe, which further oxygenates the blood that your kidneys filter every minute. These movements should feel controlled and deliberate. You are not just building muscle, you are massaging your internal systems and encouraging better filtration from the inside out. Now that we have strengthened the upper body, stabilized the lower body, and supported the core, your body is fully activated and your circulation is at its peak. However, we cannot simply stop here. We must allow the body to transition from this state of effort back into a state of recovery and repair. This next step is where we seal in the benefits of today's work and ensure your nervous system feels safe and relaxed. Let us transition into our cooling down phase to reset your body for the rest of the day. Now that we have successfully challenged our muscles and stimulated our circulation, it is time to shift your body from a state of exertion into a state of deep recovery. We will use the resistance band one last time, but this time as a tool for flexibility rather than strength. While seated, loop the band around the bottom of your right foot and gently straighten your leg in front of you. Use the band to provide a very light pull, feeling a smooth stretch through your hamstring and calf. Stretching after resistance training is vital because it helps prevent the muscles from becoming tight and restrictive, which can impede blood flow. According to a study from the Journal of Aging Research Static, stretching after exercise helps lower the heart rate and facilitates the removal of metabolic waste from the muscle tissues. Hold this position for 20 seconds while focusing on slow, deep breaths. This breathing technique signals to your nervous system that the work is over and it is safe to begin the healing process. Switch to the other leg and repeat. Next, we will perform a chest and shoulder opening stretch. Hold the band with both hands in front of you, slightly wider than shoulder width. Slowly lift your arms overhead and slightly back until you feel a gentle opening across your chest. This counteracts the tension we often hold in our upper bodies and ensures that your rib cage can expand fully, allowing your blood to remain well oxygenated as it travels to your kidneys. Finally, we perform a parasympathetic reset. Set the band aside and sit comfortably with your hands resting in your lap. Close your eyes and take 3 long, slow breaths, inhaling through the nose for 4 seconds and exhaling through the mouth for 6 seconds. This specific breathing pattern stimulates the vagus nerve, which lowers blood pressure and reduces the cortisol levels that can be so damaging to renal health over time. You should feel a sense of calm strength and mental clarity spreading through your body. By taking these few minutes to cool down, you have ensured that the benefits of your strength training are locked in and that your body is ready to focus its energy on cellular repair. As your heart rate returns to its resting rhythm, we must address the final essential component of today's practice. Strengthening your muscles is only half the battle. How you nourish and hydrate your system immediately following this routine will determine how much your kidneys truly benefit. Let us discuss how to properly hydrate and conclude our session for maximum results. Today, we have explored how resistance bands can serve as your most powerful tool for protecting your renal system. By building lean muscle, you have turned your body into a more efficient metabolic engine that disposes of glucose and clears toxins before they can ever harm your kidneys. We covered how to choose the right bands, the importance of proper breathing to protect your blood pressure, and a full-body routine designed to reduce edema and support your core. Remember, stronger muscles mean a lighter workload for your kidneys. It is critical to understand that kidney problems often progress silently and without pain. By the time symptoms like severe swelling or extreme fatigue appear, the internal damage may already be irreversible. This is why starting today matters. You cannot afford to wait for a crisis to decide to get stronger. Every small movement you make with your resistance band today is a shield you are building for your future health. I want you to know that it is never too late to improve your strength and resilience. Even if you haven't exercised in years, your body is capable of remarkable adaptation when given the right support. You are taking a brave and important step toward reclaiming your vitality, and I am honored to be on this journey with you. Your next step is simple. Within the next 15 minutes, drink a small glass of fresh water to help your kidneys process the metabolic waste we just moved out of your tissues. Then I want you to place your resistance band somewhere. You will see it every morning, like on your bedside table or next to your favorite chair. This small physical reminder is the key to building a lasting habit. Please remember that the information shared in this video is for educational purposes only and is not a substitute for professional medical advice. Always consult with your doctor or nephrologist before starting a new exercise program, especially if you have a history of high blood pressure or are currently on dialysis. If you found today's session helpful, please subscribe to Kidney Health 365 and turn on the notification bell so we can stay connected. To keep your momentum going, I highly recommend watching our next video, Kidney Safe Exercises, 20-minute seated workout for dialysis and limited mobility, which offers even more ways to stay active regardless of your current energy level. Thank you for watching and stay strong.